Hi, my name is Jessica Lee Mulch, and I'm going to be talking about vocabulary interventions for late talkers. So, the first article I read, um, it kind of started by defining late talkers, which I thought would be important for this presentation. So, it defined late talkers as children who had delays in spoken word use compared to same age peers. And I was surprised that it affected around 10 to 20% of 24-month-old toddlers. Children that are considered late talkers can also show delays in receptive vocabulary, gesture use, play skills, speech sounds, and social emotional development. This article talked a little bit about the struggles with parents dealing with temper tantrums and other types of social emotional situations when their children are struggling to communicate. So, the purpose of this first article was to examine evidence on different interventions for late talkers and look at the different approaches. The three approaches they looked at were direct, indirect, and hybrid. They also looked at intervention elements and outcomes for receptive and expressive language. The methods for this article, there were 34 intervention studies that involved about 1,200 participants. So quite a few people were looked at through this study. This, like I said before, the studies were categorized as direct, indirect, or hybrid, and that was kind of the main focus of this study. But elements, outcomes, and tools were also evaluated. So across the 34 studies, the hybrid intervention was definitely the most common. 14 of the studies used a hybrid intervention, and then 10 used an indirect intervention, and close behind that, 9 used direct intervention. So, and then one study compared direct and hybrid interventions. All studies showed improvements in expressive vocabulary. So, or I'm sorry, 93% of studies showed improvements in expressive vocabulary. And because of the high success rate, the authors stated that it would maybe be more important for the clinician and families to work together to choose the intervention type that would work best for their situation, because all had a very high success rate. So I wanted to take a second to kind of break down the three intervention categories a little bit. The first intervention category was direct, which, as we know, is where the clinician works directly with the client. There are specific targets, it's very structured. An indirect approach would be the SLP or the clinician coaching another person, usually the parent, to do the intervention. This would be more naturalistic, maybe occur in the home environment. And then the hybrid, the third intervention strategy, is kind of a nice mix of the two where the clinician and parent are working together with the child. There are specific targets typically, but it is nice because they can occur in a more naturalistic environment. So the second article that I looked at was a research article. It had some important facts, I thought, in the beginning, so I kind of summarized the important information and purpose all together. So one of the important pieces of information said late talkers may continue to score below their peers upon school entry, which is why this early intervention is so important. So negative outcomes may be mediated with early intervention. It never hurts to intervene early. There are programs such as Target Word or the Hannon program, which can be beneficial for children who are late to talk. This program is parent or guardian led. And this research study that we're about to look at looked at the effectiveness of this parent-led program. So there were 5 different SLPs that ran separate target word programs where they brought in parents and taught them how to implement these programs at home. So 31 parents agreed to participate, which added up to be 24 children receiving treatment from their parents. The goals for the treatment, or the goals for the children, included imitation goals, spontaneous single word goals, and word combination goals. So the results of this study, were very positive. The average change in score was more than 11 points, which is considered clinically meaningful in this situation. So that was encouraging to hear. Many children were also able to improve their communicative function. And if we look at the chart, we see all of the children started at the same point at their initial assessment, pre-consultation, obviously no change. But then by the time they got to that group session 5, quite a few children had moved up to a level 3 or even a level 2 that were previously at that green level 4. And then even farther along down the line, we see even more children increasing their scores to that level 3 or level 2. So why is this clinically significant? Further evidence is definitely needed to support one intervention technique versus another. In the first study, we saw that the different techniques shown had similar response rates. So it would be interesting to see some more evidence there. It is also important to be aware of the different techniques as an SLP so that we can make the right decision based on the family and their needs. What one family needs might not fit what another family needs. So it's important to know our clientele and who we're working with and what will work with different people. So thank you for listening. I am happy that I got to present on this topic.